The Edward Hand Medical Heritage Foundation was founded in 1982 by the Lancaster City and County Medical Society, Dr. Paul Ripple, and a number of other dedicated physicians and Lancasterians who charged themselves with a mission to preserve and make accessible the rich heritage of the healing arts in Lancaster County. Today, in their own words, you will hear from many of those pioneers, the founders, the movers and the shakers, the workers and the visionaries, who brought us to where we are today and who are leading us into our future.
The early founders of the Edward Hand Medical Heritage Foundation were myself, Dr. Paul Ripple, Dr. Henry Wentz, Dr. Sam Houck, David Wiley, Ed Lancaster, Mary Ellen Smith, Judy Eshman, Joan Boben, Gene Wood, and medical supplies person.
Among the people who really have made major contributions to the development of our foundation and the museum were people who helped develop our collections. And also that included categorizing this collection, putting it on the computer, and developing a system so we can have easy access. And they include people such as Joan Boben, Dr. Ernest Wood, Roger Peterson, John Corcoran, and a couple of others.
The name Edward Hand for our Medical Heritage Society came from the fact that here was an interesting man who had been a general under George Washington. He had been a practicing physician in the city of Lancaster, and he was a well-respected man who built his beautiful mansion just off the Conestoga River. He was the perfect name for the Historical Society. The original collection was held in Dr. Ripple's basement. From there, many pieces were also held in the Lancaster City and County Medical Society building on Walnut Street. From there, everything was collected and placed in the Marshall Street garage storage area, which was held by the Lancaster General Hospital. The collection was growing very fast. There was lots of furniture, lots of books, and lots of pieces of really collectible material. We also had a lot of medical material, solutions, pills, drugs, etc. Anyhow, from there we were moved to the new site in the Borough Complex, previously inhabited by Radio Corporation of America. The last move that we had was in that complex just across the hall to a nice area where we could have a museum display and storage as well together.
What I'm particularly proud of is the fact that we were able to develop a virtual museum, which now makes it possible for people to be able to see what we have in our collection. And I have to tell you, that's only in the beginning stages. We have plans to be able to make much more to do with the virtual museum.
Lancaster General Health, Penn Medicine, is pleased to join the other community hospitals in supporting the Edward Hand Medical Museum. Preserving history of medicine is natural for us. We started in 1893, the hospital is a charter, and we looked at a timeline and exhibits, medical exhibits that would, talk about the evolution of medicine between 1893 and 1993. That was our 100th anniversary. We do our 125th anniversary next year, so a lot of the things with Edward Hand fit with our commitment to preserving the history of medicine in Lancaster County, and we look forward to the next 100 years.
We are very grateful to Lancaster General Health for the donation of space at the Borough Center. However, it's not particularly accessible to the public or to those students who are interested in medical heritage. And so we have on several occasions thought about where we should move and what kind of space we might need for our museum.
I think that we are a little unique in the fact that we are one of the oldest communities in the history of the United States of America, and we have a rich history of medical. We have the second oldest hospital, the almshouse in Lancaster, still standing. So we have a very rich history, and we have the Attlee family who helped to start the AMA. So we have a lot to be.
Preserving artifacts depends greatly about what the history comes with it, what its period was in usage, who had used it, and where they lived. Once we have all these factors put together, and the material that we've been presented with is museum quality, we will certainly put it in our collection.
Some of the notable items in our museum are, of course, everyone probably loves the iron lung. A lot of us are children of the polio epidemic, and it's just so fascinating to see it, and a lot of people, the younger people, never have. So it's got to be one of my all-time favorites too. Another thing I love are the infant and adult feeders. Before IVs and various ways to get liquid and food into people were feeders, and I brought along one. This is just my own personal one, and it's very plain. Our collection has some beautiful China ones, actually China patterns made in England, Germany. So that is something I just love to look at. The other thing I'm crazy about are the pharmacy bottles. They're just beautiful when the light hits them, and that intrigues me. So those are my three favorites.
What are important considerations for collecting today? Well, I think stories from doctors are important because I think there are a lot of stories that are rather unique and would be interesting to lay people about the experiences of doctors. In the early 1900s, I think around 1915, Dr. George Durant, a prominent surgeon known for his work on cancer at the University of Pennsylvania, was invited to talk to the medical society, local medical society, and present a paper on blood transfusions when transfusions were given person to person. And following the meeting, he offered to go to the hospital the next morning because people stayed overnight in those days and they demonstrate a blood transfusion person to person. One of the doctors in the back of the audience asked him who he was going to transfuse. And he said, well, there's usually a person with pernicious anemia in the hospital, and I'll transfuse him or her. The man in the back said, well, we don't have people with pernicious anemia in the hospital. We give them all liverwurst and they go home.
The early surgeons in Lancaster were the Attlee brothers. I've had the privilege of knowing two of them, John and William. Later, these were later relatives of the initial John Attlee. They both worked at St. Joe's Hospital and the Lancaster General Hospital. And in those days, there was a lot of competition between the two hospitals.
The fourth John Attlee had 4 children, 2 of whom is daughters who live in Lancaster, Ann Weber and Liz Jones, and they had a surgical kitten that was in the family, and they had information that suggested that some of what was in this kit included equipment that was used by Edward Hand. We now have that piece, that surgical kit, and we know that most of what is in that surgical kit was probably designed and manufactured in the 1820s, 1830s, but there are a couple of other pieces in there that probably date back to the time of Edward Hand.
The most common question that we get is, how big is our museum? How many pieces do we have that people would be interested in? At this point, we have over 11,000 artifacts.
The pharmacy became part of our collection in a very interesting way. Dr. Wiley was president at the time. I think I was the immediate past president. And he found it. A friend told him about it. It wasn't a Lancaster County item. It was in New York. And he came to me to help him figure out a way for us to get it. He had pictures, and immediately I fell in love with it too, because it just seemed to belong to us, even though it wasn't Lancaster County. So we had no money in the treasurer, which is kind of an interesting thing. We did some soliciting and didn't get very far with that. So we were about to lose it, and it was going to another bidder, but apparently the owner really wanted us to have it. He had established a good relationship with Dr. Wiley. So Dr. Wiley and I put our heads and wallets together, and Dr. Wiley arranged for the truck and all of the people to help move it, and I wrote a check to pay for it.
What we have in Lancaster is a building, and it's called the Lancaster Almshouse / Hospital, that was built in 1800. It turns out that it's probably the second oldest standing hospital in America. In addition, we have developed 3 other hospitals in Lancaster County in the interim. That includes St. Joe's Hospital in 1883, the Lancaster General Hospital in 1893, and much later in the early 20th century Community Hospital, which is the Osteopathic Hospital of Lancaster, and I have to add Columbia Hospital, as well as the Eckert, I might add. So those are, 6 hospitals that we had in Lancaster County? About 6 years ago, we came up with the idea of providing students in the local colleges opportunities to do research in medical history. And thanks to generous donations from the medical staff at Lancaster General Hospital, we have been funding 1 or 2 students every summer, and sometimes even during the school year, to help us do research on various aspects of medical history in Lancaster.
The goals of the Edward Hand Medical Heritage Museum are to assure that we have an up-to-date and effective and inclusive collection, that we provide educational services outside the museum, that we maintain our fiscal stability, and that we do a better job marketing and communicating to the public what we are and what we stand for.
We hope you enjoyed hearing from some of our leaders. Now take the opportunity to explore our museum. Lancaster is an old city, so we have some amazing medical history, including the second oldest standing hospital building in the United States and some extraordinary medical artifacts. Explore our museum and see some of that unique history on display, as well as an even larger area where equipment is being cataloged and researched. Learn about the early medical care in Lancaster County. It has been said that those who cannot remember the past are condemned to repeat it. See our exhibit on quackery medicine and recognize that there are treatments today that will not stand the test of time. Remember that today's catchwords, such as natural and organic, do not guarantee good health. Take the opportunity to explore our museum and reflect on how money, politics, climate, and education can impact medical care, and how historic achievements of clean water, healthy food, education, and vaccinations, as well as antibiotics, have saved more lives than all of modern medicine. And yet we have trends today against vaccinations, risks from old and new infections, and problems with the availability of these essentials. In addition to exploring our museum, please visit our website, www.edwardhandmedicalheritagefoundation.org, and see our virtual museum. Follow us on Facebook and come back again, because the medical care that you receive today may be part of the history shown in our museum tomorrow.